And that's time for the latest in the series of our audio diaries from people across Scotland who are helping in the fight against coronavirus. We're hearing from emergency departments today. Dr. David Chung is a consultant in emergency medicine at Crosshouse Hospital in Kilmarnock and Vice President of the Royal College of Emergency Medicine in Scotland.
It's been over a month now, and working in an emergency department has been unlike anything we've done before. Indeed, the way the hospitals are working is certainly like nothing that's been done in the working lifetimes of anyone who's there just now. And there've been so many positives from this, so much cooperation, so many things that we were told had been impossible for 10 years or were too difficult to implement were swept aside in the space of certainly days, and if not hours in some cases. We were able to create new systems that were able to provide care for what we were fearing would be an unprecedented amount of patients. Thanks to the efforts of everybody in Scotland, we have flattened the curve. I don't think we could deny now that this has definitely been a success. We've had more patients in intensive care than before, but it has not been as bad as we were fearing, and it's not been as bad as other parts of the world. But we're now left with a challenge of where do we go from here, which everybody's asking, whether it's about lockdown, but in the health service, it's about how can we safely provide care for where we are just now. We saw our numbers in emergency departments drop to almost a half, and that was almost certainly too few patients come into the emergency department. Normally, you might expect there's about 20% of people going to an ED who should be treated somewhere else. And we're pretty much back up to that level now. So the numbers attending emergency departments are now up to 75-80% of what our previous average would be, if we bear in mind that that average is probably too high. But we need to be able to provide safe care now within the health service to reassure people that it's safe for them to come, because we do know that there have been people who are absolutely terrified to go near a hospital for fear that they get COVID, and we need to think of a way to solve that. And there's really only, at the moment, two ways immediately we can do this. To protect people, you need to know whether people are COVID positive or COVID negative, whether they're actively going to infect somebody. And the only way around that is testing. So we really need to test as many people as we can, especially staff, to make sure that they know what status they are and how much of a risk they pose to patients who are coming to the hospital. And if we can do this, and we can totally reassure patients that they're going to be treated by people who are known to be COVID negative, hopefully some of the people who've been sat at home with conditions which should be treated will come back. The other thing that we need to do is to use personal protective equipment, not for the benefit of the staff, although that's very important, but to absolutely ensure that we protect the patients coming to healthcare settings wherever it may be. And that might mean from here on in that every time you see a patient, you're wearing a mask and a pinny and gloves to reassure the patient that you are not going to infect them. And I think that's something we're just going to have to live with until we get to the end of this, until there's been a vaccine, or until 3 or 4 years down the line we're testing and we've tested and found that everybody has had the virus. So I think healthcare is going to look different. It can't go back to the way it was. There were also a lot of patients in emergency departments who shouldn't have been there, not because they had minor conditions, but because they actually were meant to be somewhere else. In this case, in a ward, in a safe place. And from a point of view of infection control, we definitely cannot go back to the days only just before this where we were seeing on a bad week in Scotland 1,000 people waiting on a trolley in a corridor for a bed somewhere else in the hospital. We cannot expose what are usually old and vulnerable people to these risks of infection by letting them sit there. We have to create better systems to ensure people go to the safest place that they need to be.
Our audio diary today from Dr. David Chung, consultant in emergency medicine at Crosshouse Hospital and also Vice President of the Royal College of Emergency Medicine in Scotland.
Now, this weekend, reading